Welcome back to the Morning Blend. The holidays are fast approaching, and all that eating, traveling, and stress can really take its toll on your health.
Heart attacks and other heart-related issues tend to spike during this time of year, and here to discuss simple changes that can put you on the right track is Healthcare Partners Nevada's Healthcare Partners Nevada Chief of Cardiology. There we go, Dr. Stephen Ports. A lot of stuff there. Stephen, how are you, sir?
I'm doing good. Thanks for having me back today.
Let's talk about heart disease. Can you explain what heart disease is and how prevalent it is here in the States?
Yeah, it's really prevalent. It's the #1 killer of United States citizens.
Wow.
About 600,000 or more deaths every year from that.
No kidding.
More deaths than all cancers combined.
Wow.
And many times it's thought of just a man's disease, but roughly half of those 600,000+ deaths are in women.
Wow.
So very prevalent there.
How do we reduce our risk factors? What do we need to know?
Those are important, and important to follow up with your physician. The biggest thing that we see, I mean, if you walk around the country, you'll see we have a real crisis here with obesity.
Yeah.
And overeating leads to so many different diseases, the diabetes, the high blood pressure, which in turn leads to vascular disease and injury, heart attack and stroke. So the biggest thing is healthy nutrition. You've got to get rid of some of the bad foods, all the carbohydrates. You got to eat more vegetables. There should be vegetables on every plate, every meal, healthy lean meats. And then the other biggest thing is exercise. I want to see people out there exercising at least 5 or 6 days a week, 30 to 60 minutes. That's very important. Keep that body mass down, keep the lean figure, and that will help prevent the hypertension, the diabetes. If you've already gotten there, it's never too late to turn around and lose that weight and take care of those diseases and reduce your risk.
So you're saying putting ketchup on your burger, not worth a vegetable?
No.
Not a vegetable. Okay. Just letting that be known. Symptoms of heart disease, what are the certain things we should be looking out for? Is there any early symptoms we should be seeing?
Yeah, many times heart disease kind of sneaks up on you. They can be quite subtle. The pain that people expect to be excruciating, horrible pain, doesn't always get there. Many times it can present with just fatigue, getting tired. We think, well, I'm getting kind of old, doc. You know, this can't be my heart.
Yeah.
And no energy. Even before the pain and discomfort starts. When those symptoms come on, don't always attribute it to something else going on with life. You should still feel good. 60 is young, 70 is still young. Get in and see your doc and have that checked out.
Are the symptoms typically that chest pain? That's the giveaway for that?
Frequently it is, but many times, you know, it's also just in the jaw or in the arms. And many people just have what I was just saying, just fatigue and shortness of breath, no energy, and really don't have pain. Or if they do have pain, it's so mild that when I tell them, yeah, that was your heart, they go, you'd be kidding me. I would have never suspected this to be my heart.
So let's talk about heart attacks for a moment then. Without getting too technical, obviously, what is a heart attack?
Heart attacks are just when the blood supply to a certain part of the heart muscle is shut off. And all heart attacks are bad. Some of them are very big and lead to a lot of damage to the heart. Some of them not so bad, but you can present with electrical instability, have sudden death right there before you even get help.
Wow.
So they're all bad, and they need to be caught early. We're very good at treating them once we get the patient to the hospital alive with early warning systems, even getting EKGs, you know, in the patient's house before they even get to the ER to activate the cardiology team.
Now, your practice practices something called the Total Healthcare Model. What is that?
Well, we have a system where our primary care physicians see and take care of the patients. We have an integrative model with cardiology available, with the different subspecialties all available, healthcare workers, social workers, nurse care coordinators, even to help patients with transportation, setting up appointments, and even giving you a healthy shopping list to go to the store with.
And I understand we're under in the middle of Medicare open enrollment right now as well.
Right.
Very important time.
That occurs at the end of each year. This year it's October 15th it started and ends December 7th. And it's an important time. This is mostly a senior-related program, Medicare eligible patients, where you choose perhaps a new program that you want to get into for different drug coverage, different physicians, and different systems. And it shouldn't be confused right now. There's also the enrollment into the Affordable Care Act or Obamacare.
Totally
It's totally separate, totally different. And those who have Medicare eligible, they don't need to worry about that part of that. Strictly, just for those who fall into that program.
Can people go on your website to learn more about the open enrollment process?
Absolutely. We have a lot of information there at hcpnv.com. There's also Facebook, Twitter, a lot of different educational programs and get-togethers to help seniors make decisions on what direction they'd like to go in health.
Doctor, pleasure as always.
Yeah,
All
it's
right.
great to see
Thank you very much.
Get Heart Healthy. If you want more information on what you've seen this morning, just head to the website on your screen, Healthcare Partners Nevada, also on Facebook and Twitter. Still to come.